There's actually some more proof that people actually like government-run healthcare. Oh my goodness. Now, why do I say this? Well, it's because some of the numbers for the Medicaid expansion have actually came out. In the first 6 weeks since open enrollment, nearly 500,000 people in 10 states have enrolled in Medicaid. Now that's great. And of course, there's a lot of states that did the Medicaid expansion. How many? Well, there's 25 states that have so far expanded Medicaid. And remember, the nearly 500,000 people, that's only from 10 states. So the data is not yet complete. In contrast to this, we go to private plans. Now, private plans, even though the numbers haven't been released, I'm pretty sure private plans not going nearly as well. In fact, I think the numbers are probably going to be very disappointing. Now, there are a few factors, of course, that play into that. The fact that there's not a lot of people signing up for the healthcare exchanges. Now, for one, of course, there'd be the cost. Some of these plans are still pretty fucking expensive. And when you're in college and you're working a minimum wage job, it's going to be really, really, if not hard, if not impossible, to still buy a health insurance plan from the exchange. So, I mean, keep that real. That's one of the problems with the law. That's why we need a public option. Not only that, but you've also got the problems with the website. Yeah, the website's still fucked up. They need to get that shit fixed. Not to mention that there's also a lot of misinformation about the law. People don't know about it. People don't know how to sign up, or maybe they're just not interested because they think there's going to be a death panel or something. I don't know. And of course, there are people who are uncomfortable with signing up on the exchanges. They just don't want to do it. They would rather pay the penalty, which, hey, that's their choice. Now, according to Dan Mendelson, going back to the Medicaid, and he's the president of Avalair Health. Now, Avalair Health is a market analysis firm that actually compiles Medicaid data from the states that chose to expand. Now, he says about the Medicaid expansion, he says, quote, Medicaid is exceeding expectations in most places. It is definitely a bright picture in states that have chosen to expand. Good news, right? I mean, that's great for the people that can actually, like for the states that have signed up. Medicaid is a great thing for poor people. Now remember that we did that study. Half of Americans make less than $30,000 a year. Those are the types of people that qualify for Medicaid. In fact, I have the numbers. You have to have an income around 138% of the federal poverty level in order to qualify for Medicaid. Now let me break that down into some easier numbers. Now, that's actually around $15,856 a year for an individual, all right? And $32,000 for a family of 4. So that's another reason you're seeing such a large amount of people that are signing up for Medicaid, because they're eligible and they're poor. They can't afford to go on the exchanges. Now, a lot of state hospital associations, medical groups, and advocates for the poor are actually massively, massively in favor of the expansion. And it's expected to mainly help low-income adults with no children living at home. So like I said, it's going to help a lot of poor people. Those are the same types of people that are more likely to be uninsured because they've been essentially priced out of the market. State hospitals actually support this because it means that bills from emergency room visits no longer go unpaid like they used to, which is a good thing, because you realize when that happens, when somebody doesn't pay their hospital bill, that cost gets shifted somewhere. It gets shifted to the people that have insurance, and it raises their premiums. There are actually, for the people that are actually worried about the cost of the states, and there are quite a few. According to the Center for Budget Policy and Priorities, additional cost to states represents a 2.8% increase and what they would have spent on Medicaid from 2014 to 2012 in the absence of health reform. Only 2.8% more. So, I mean, that's pretty good. Not only that, but according to the Urban Institute, the Medicaid expansion will reduce state and local costs for hospital care for the uninsured. And in 2008, state and local governments paid 20% of the cost for caring for uninsured people. Now that comes out to about $10.6 billion for the states. Now that's really expensive. According to the same report, this 2.8% figure significantly overstates the net impact on state budgets because it does not reflect the savings that state and local governments will realize in other healthcare spending for the uninsured. Now, the Urban Institute has estimated that overall state savings in these areas will total between $26 and $52 billion from 2014 through 2019. And the Lewin Group, who's actually also doing these studies, estimates state and local government savings of $101 billion in uncompensated care. So this is going to help out state and local hospitals and governments. Now that's a good thing because they're already paying a high cost for Medicaid in the form of people that are uninsured that have to get paid for somehow. These people still have to get paid for it. And besides, when you have Medicaid, when you have some form of health insurance or something, you are more likely to get preventative care. Preventative care helps avoid disasters later because you can catch things early when they're more easily treatable and cheaper to treat. Not only that, but when you get into better health routines and when you get things taken care of early, it prevents the situation from snowballing and leading to very, very expensive health outcomes, which is what we had before. People wouldn't go to the doctor. Why? It's too expensive. I don't have health insurance. I can't afford a doctor visit for a checkup, or, oh, I got something minor that's wrong. I'm not going to go to the doctor. I can't afford it. And then it turns into a major, major issue that you end up hospitalized anyway for. So, and then who gets to pay the bill? Well, certainly not the uninsured person, because it ends up going to the state and local hospital and the taxpayers. So either way, you're paying for somebody's medical costs. Now, Medicaid actually pays a lot lower rate than private insurance and Medicare. So there's actually a lot of savings in expanding Medicaid to these poor people. Now, of course, another boon to the states is the fact that the Medicaid expansion is mostly paid for by the federal government. Well, how much? Well, the federal government actually pays 100% of the expansion costs in the first 3 years. And then, after that 3 years, they can pay no less than 90%. So the states save a lot of money. And to the states that are not expanding Medicaid, dude, what the fuck are you guys doing? You're turning down federal money that would go to a program that would help you save money. Also, you can give a middle finger to the poor. Even Governor Jan Brewer realized that, hey, you know what? There's a lot of savings in this expansion, and we get federal money that was just going to go to somebody else anyway. Well, and that's not fair because we pay into the federal government in the form of taxation. My citizens pay into the federal government. Why shouldn't they get something back in the form of Medicaid, which will cut costs for the state overall by helping the uninsured? She gets it. Why don't you get it, Bobby Jindal? Why don't some of the other Republican governors get it? This is going to save money. But you want to poke a finger in President Obama's eye because you don't like the guy. Well, a lot of people don't like it. It doesn't really matter because a good policy is a good policy. And you should do what's right for your constituents. But there I go, being naive. According to the, once again, I'm going back to the Center for Budget Policy and Priorities study on this, Medicaid costs less, like I said, than private insurance. And the costs also grow more slowly than private insurance. So that's another way that they save money. So it's a good program, and it's very cost effective. So maybe some of these people should learn from where it is working and say, hey, you know what? Maybe we should be fair to our citizens and try it here. Because you're leaving a lot of people out in the dust when you don't expand Medicaid. So I think they really need to get with the program. Hey, thanks for watching this video. Please leave a comment below. And if you enjoyed this video, make sure to hit the like button and share with your friends. If you want to see more, go to our channel at youtube.com/TYTNation. And if you really want to support the show, support this channel, go to our fundraising campaign at www.patreon.com/TYTNation. The website is in the description below. Thank you guys, and keep watching.